Good afternoon, Team Red. Welcome to your teaching scenario. This is a pre-hospital one, so there will be a first unit arriving with 3 paramedics. Who will be the team leader?
I will be.
So Minna, you are the team leader. So with you there will be 2 other paramedics arriving with the first unit at the scene when we start. If extra help is needed, it can be activated by calling the general alarm number. Any questions regarding the environment?
No.
Okay. You can do the team allocation now.
Okay, so team allocation. Konsta, you take the airway, and Maiju, you take B, breathing, and Jenni, you take C, compressions, and Gina, you take D, defib. Okay?
Okay.
Alright. I will give the scenario now, and when I'm done, I ask you to repeat it for me, so I know for sure that you understand the scenario. Okay. We have a 35-year-old male called Chandler, and he's been diagnosed pneumonia 3 days ago. He's on oral antibiotics, and sister is worried because Chandler is not doing well, and she wants you to come and assess the patient.
Chandler, 35-year-old male, diagnosed with pneumonia 3 days ago, treated with oral antibiotics, is not feeling well, and sister asks us to assess him.
Okay. Are you ready?
Yes.
Okay. Please enter. Go.
Oh, thank God you are here.
Hello, ambulance
Hello.
is here. What's your emergency?
My brother is not doing well. We tried to go to the bathroom and he collapsed, so I called for help. He was diagnosed with pneumonia 3 days ago, and I think he has these antibiotics going.
Okay, do you know if your patient, your brother has been tested for COVID infection?
No, I don't know if the COVID test is taken or not.
Okay, then please miss step aside so we can treat your brother.
Okay.
Charles, are you awake?
He's not answering you.
Okay. Can I see any respiratory effort?
Chest is rising.
And noisy.
You can hear noisy crackles.
Okay, can I feel a pulse?
There is a pulse.
Okay, I will start high flow O2 with reservoir bag and call for extra help. Team, please put on your airborne PPE and call for extra help. There is possible COVID-19 patient and need for early airway management.
Okay.
Okay, so additional help is coming, and let's see what we have.
Extra help is called. They are on their way.
Extra help is called. Okay, excellent. Maiju, please take A suction and see if he tolerates OPA. Gina, please assist as needed and start monitoring. Okay.
You can see mucus coming up, but still crackling sounds.
Okay.
He doesn't tolerate it.
Okay. At this point, because of lack of resources, we will continue with O2 mask treatment. Maiju, please listen to your chest and do percussion. Gina, please attach SpO2 meter and count respiratory rate.
Okay.
Good air entry, bilateral, crackling, breathing sounds, but bilateral equally.
Okay.
Resonant, resonant.
Resonant. Is our SpO2 meter showing anything?
Shows pulse signal.
Or signal. We will still continue with O2 treatment with mask. Gina, please attach BP and 3-lead EKG. Maiju, please feel the peripheral and radial pulse.
It's really fast and shallow, but you can feel it.
How about the periphery?
It's cold.
Periphery cold. Maiju, please check CRT.
1, 2, 3, 4, 5.
It's 5 seconds.
5. Prolonged. Maiju, please prepare IV crystalloid. We will give 250 cc bolus. And what is our BP showing?
It actually doesn't give any good reading. It's just, you know, bad signal.
Bad signal. Okay, Gina, please elevate patient's legs.
Okay.
And after that, please open IV connection and take blood glucose at the same time.
Here.
Maiju,
Yes.
when you are available, please prepare noradrenaline infusion. We might need it.
Okay, I will do the
Good afternoon.
Hi team, Konsta, please take care of the airway. Note that there is possible COVID-19 infection. Jenni, please open another IV line and take vena astrup and other blood samples.
Second IV and blood cell.
And Konsta, with that mask ventilation, use co-people technique, attach fire filter and keep.
Yes.
The noradrenaline infusion is ready.
Thank you, Nora, ready.
First IV line is ready. 250 liters bolus.
Thank you, Gina.
Blood glucose
So
is
we can
ready.
move to
What is our blood glucose?
6.7.
6.7, okay.
When Konsta started backing, they actually noted that patient is not doing any respiratory efforts anymore and he's not reacting anymore.
Okay, Jenni, excuse me. Chandler, are you awake?
He doesn't respond.
Can I see any breathing effort?
Chest is not rising.
Can I feel the pulse?
There's no pulse.
Patient is in cardiac arrest. Let's start CPR. Jenni, start compressions. Tina, please give feed backup device to Jenni and attach defib.
Yes.
Tell me when defib is ready.
I will.
30 compressions.
Compressions, ventilations, 30 to 2.
Defib is ready.
Defib ready, so we will perform initial rhythm check on my count. Konsta, please place your finger on carotid pulse. 3, 2, 1, stop. Pulse,
There is no pulse.
continue. Patient is in a PEA. Gina, please take 1 milligram of resuscitation adrenaline and give it to patient with bolus, IV. And yes, Konsta,
Yes.
please proceed with early intubation when possible, and Jenni, please assist Konsta.
Yes.
Milligram adrenaline.
1 milligram adrenaline given, thank you Gina. Excellent compressions, Maiju, brilliant work. And Konsta, please remember capno and filter and feed.
Yes, I will.
Patient is now intubated, but Konsta tells you that it's impossible to ventilate now. So there's really hard resistance, and you can also see a tracheal midline shift to the right side.
Okay, Jenni, please auscultate the lungs. start from left side. We might have possible treatable pause, tension pneumo. Ask Maiju to stop.
No breathing sounds on left side.
Okay, Maiju, continue. Jenni, please perform needle thoracentesis on left side.
Needle thoracentesis on left side.
So air coming up, high pressure.
Konsta, how's the ventilation now?
No, with
It's easy to ventilate now.
Good. Okay. And Gina, please tell me when we have set.
Actually, your 2
left.
minute interval is up within 10 seconds.
Within 10 seconds. Okay. Konsta, please place your finger on carotid artery. And Maiju and Jenni, be prepared to switch on my count. 3, 2, 1, stop. Continue. There is VF shockable. Gina, please perform safety defibrillation with 150 joules.
Safety defibrillation 150 joules.
Exactly.
Charge, don't shock. Clear, shock. Continue.
Okay, first shock event. So team, we are in shockable rhythm algorithm in the protocol. At this point, let's think of other possible treatable causes from T's. Tension pneumo, we have already taken care of that. Thrombosis, pulmonary in this case, possible. From H's, hypoxia, we are treating that. Hyperkalemia, other metabolic disorders, possible. We have taken samples, no results yet. And Jenni, excellent work with compressions, really good quality. What is our GAPNA showing?
It's actually showing 2.6.
2.6, brilliant. Any concerns, team?
15 seconds.
15 seconds to rhythm check. Konsta, please place your finger on carotid. And Maiju, if needed, be prepared to release Jenni. And we will perform rhythm check on my count. 3, 2, 1, stop. Pulse.
There is a pulse.
There is a pulse. Maiju, do not start compressions. We have ROSC at time 18:06. We will mark it down and move to phase of post-resuscitation care. A, how is ventilation?
It's easy to ventilate, so no resistance anymore.
So our airway has been taken care of with intubation. Is there any gagging of the tube?
Patient tolerates the tube well.
Okay, but Jenni, please prepare fentanyl and propofol if we need them. Maiju, please auscultate the lungs.
Still noisy crackles, bilateral.
Noisy crackles bilateral. Okay, what is our SpO2 meter showing?
88.
88. Okay, what is our CAPNO showing?
5.2.
5.2. Great. Konsta, aim between 4.5 and 6. Adjust your ventilations according to that.
Yes.
C. What is our BP?
Blood pressure is 104/67.
Okay, we will need noradrenaline soon when the effect of adrenaline stops. Then our rhythm is tachycardia at the level of 130. What is our CRT?
3, 4, 5.
Still 5 seconds.
Okay, what was our blood glucose from the measurements?
6.7.
6.7. Okay, Maiju, please check the pupils.
They are equal at size and reacting to light.
Is there any reaction to pain?
He doesn't react at all, no.
Okay, and Maiju, please temperature from the ear.
Yes.
And Gina, please expose the patient. Do we see any swelling, rashes, anything like that?
Nothing special there.
Okay.
Temperature was 37.2.
37.2, okay, and we want to aim to normothermia, so we don't want to warm the patient or either pull him down under 36.
Okay, thank you, Minna. Where would you like this patient to be transported?
Patient should be transported to COVID-19 ICU to the closest university hospital.
Okay, team, let's stop here.
Okay.
Okay, team. I think we can all agree that this was a really tough scenario. Minna,
Yes.
you were the team leader. What's your first impression about the scenario?
The scenario was quite challenging, especially due to certain protocol variation that we have to make because of possible COVID-19 infection.
Okay, yeah, that's correct. If you stay here, you decided to put on the high-level PPE, so airborne precaution PPE, already early stages when you arrived.
Yes.
Why is that?
It's because according to the information that we had, patient has pneumonia, community acquired, and his situation has been getting worse. We didn't know if COVID-19 test has been given, so we need to take that into consideration, that the risk for the infection is high, and then it's better to be safe than sorry.
Okay, yeah, makes sense. It actually looked quite well, the performance of your team. I'm sure that you had some kind of plan how to handle the situation. Did it go by the plan? How do you feel about that?
Most likely, the patient developed tension pneumothorax quite quickly, and you had to adjust to changing situation quite quickly. But I feel that the team performed really well and was able to adjust to quickly changing situation.
Okay, team members, how about the situation with the tension pneumothorax? That's quite dramatic situation. How do you think it went?
Well, I think Minna reacted really quickly, and he was calm. She was calm, but still, you know, she gave all the instructions very well, and she could instruct me when I was doing the compressions, and then she instructed Jenni, and yeah, I think she did it really well. So we knew what to do.
Okay, so
and
you
then
think
everything, like, it was quickly over, and then we went back to.
Yeah, it was a surprise for me that
protocol.
the ventilation went bad really fast after the intubation.
But you are saying that the leadership was solid.
Yes.
So you knew what was happening and what was expected from you.
Yes, and I think she gave us really good instructions, like with name, Maiju, you keep on doing that, and Jenni, would you do that, and so it was easy.
Okay. How about non-technical issues? How was communication with the team members? Any comments on that?
Yeah, from Minna, it's really clear. It was really nice and easy to be in the part of the team.
Yeah.
Because there's tasks what Minna gave us, they are clear. They were clear, and also Minna asks that is it already done, or wait for this closed loop communication,
Yes.
as
Really,
the book says.
Yeah, really nice closed loop communication.
Of course, I would like to point out that it makes communication a bit more challenging when you have the full protective gear on. You cannot see facial expressions or read from the lips, because normally you have quite a lot of communication with your face expression during this kind of situations.
That is so true. That's one issue with situations like this. So non-verbal communication can't be read. Yeah. Okay.
Also, this area was quite tight, so I think would it be a good idea to get one person out from the situation and for to get drugs ready and everything. So because we are now, because of COVID risk, we are already everyone are around the patient.
Makes everything much more challenging. That's true. Okay. How about the ventilation? So you noticed it's a problem with A and B.
Yeah.
You started O2 early, high flow oxygen. You decided not to go with back valve mask ventilation early stages. Why is that?
Yes. In this situation, it was due to possible COVID-19 infection, and we know that with back mask ventilation, there is higher risk of producing aerosols, and it involves 2 people, and we didn't have appropriate resources for that, and early intubation is preferred, so that's why I decided to wait for extra help to arrive.
Okay, that clears it up. Well, I must say that you managed extremely well under the pressure, really challenging case. So, thank you, team.
Thank
Continue
you.
the same way.
Thank you.
Can I suggest one point at the end of
Sure,
this
please.
exercise, that this ICU where you want to take the patient, what is the best one? I have heard that it's in
The one in Sweden.
In Sweden, in
Oh,
Skellefteå, yes.
Skellefteå.
Skellefteå ICU.
Okay.
Yes.
Okay.
Excellent
That's the place.
reputation.
Okay. Thank you.